I'll tell you a little bit about myself. I am a pelvic floor therapist. I'm also a dancer, and I have 2 kids. I treat physical therapy patients who have pelvic floor disorders. So that means I treat anyone who has incontinence, pelvic pain. It could be urinary incontinence, fecal incontinence, tailbone pain, pain with your pelvis, peripartum issues, abdominal separations. That's like the biggest, gist of everything. There are more diagnoses within that, but that's most of what I treat. You probably have some questions about what does that mean to go see a pelvic floor physical therapist? And I'm kind of like the gynecologist of the physical therapy world. So that means that when you come see me, I'll screen you for your like back pain and hip pain, but you also will get a pelvic exam if you're okay with that. I treat all genders and anywhere in between. So yeah, I'm okay to take questions like as we go along, and then at the end there will be extra time to ask questions. So does anyone have any questions right now, just to kill some time, let more people sign up, just about like what I do as a pelvic floor therapist? You can unmute yourself. No? Okay. So I'll just give it like another minute or so, and then I'll start going into like what your pelvic floor actually is and how it functions and how that relates to dance or any exercise whatsoever. Oh, I forgot to say, I also treat organ prolapse is one of the other diagnoses. Okay, so I'm looking in the chat and I see some people are asking some questions. Someone asked, am I going to start my own practice? In the future, most likely I will. I have not done that yet, but long-term, that's my goal. So maybe in a year, we're gonna see. Okay, so I'm gonna start just talking about what exactly is your pelvic floor. So your pelvic floor is made up of 2 sets of muscles, and you have superficial muscles of your pelvic floor and deep muscles of your pelvic floor. I have some different models that I'm gonna show you. So here is a pelvis. So if this is what I'm sitting, and then if I turn it so that you can actually see the muscles, these are your superficial muscles of your pelvic floor. So they're your first layer. And then underneath are your deep muscles of your pelvic floor. And then here you can see these are deep muscles of your pelvic floor. I'm going to show you in another picture. Here's your superficial muscles of your pelvic floor. And then these are the deep muscles of your pelvic floor. And they go all the way up. So up here is your pubic symphysis. Down here is your coccyx and your sacrum. And they connect all the way front to back. And then here's another picture for people with a penis. Here, deep muscles of your pelvic floor. These are superficial muscles of the pelvic floor, and they are continuous with the penis, so they go up the shaft. So you can see that the muscles are actually the same between like anyone who has a pelvic floor, basically. So the superficial muscles of your pelvic floor can help you like go to the bathroom, control like urethral contraction and relaxation versus rectal. Your deep muscles of the pelvic floor is actually what I really want to start talking about today. It's made up of 3 different muscles, and all together they're called your levator ani because that's the action that they do. They lift your anal region. I can give you all of the like anatomical names and everything, but I'll just give you the names and we'll just leave it at that and then call it your levator ani. They are your coccygeus, your pubococcygeus, and your puborectalis. I had to look. So basically, here they are. 1, 2, 3, just like that. So what do your pelvic floor muscles do? Since they go all the way from the front to the back, they govern all of your holes down there, all of your parts. They are muscles just like any other muscle of the body. They contract and they relax. They allow you to go to the bathroom by relaxing, and that's that bearing down motion when you go to have a bowel movement. And then they contract so that you can not go to the bathroom when you don't want to. And they also have the sexual functions. So they contract and relax during intercourse too. They also, one of the biggest things I want to talk to in regards to exercise and dance is that they are a part of your core. So people talk about you want to train your core all the time. You want that to be super strong and stable so that when you're moving, you have good balance and you can move dynamically without any problem. But they don't talk about like, what does that actually mean, train your core? People think, oh, I'm just going to do like a bunch of sit-ups and crunches and leg lifts. And that's actually not the whole story. Your pelvic floor is a part of your core. You have like an internal canister. So you have on the top, you have your diaphragm. Stand up so you can see my trunk. On the bottom, you have your pelvic floor. In the front, you have your abdominals, and in the back, you have your back muscles. So that whole thing is your internal canister. And what that does is, since it's a closed system, it has internal pressure. It's called your intra-abdominal pressure. So what happens is when you go do like a crunch, or you pick something up, or you push something, or you jump, you have an increase in intra-abdominal pressure. And this is totally normal. That also happens when you have a bowel movement. But there is such a thing as too much. So this is the thing that we just want to be aware of. When you have too much intra-abdominal pressure, then you have a downward pressure on your pelvic floor, because what's happened is you have breath holding, and your diaphragm is pushing down, and then that also pushes your pelvic floor down, but there's nowhere for that pressure to go. So that is, over time, can lead to or contribute to, it is not the only cause, but it can contribute to organ prolapse, pelvic organ prolapse, and disc bulges or disc herniations. So this is why it is important to strengthen our core. But it needs to be balanced, because if we're only strengthening our abdominal muscles and our pelvic floor is very weak, then we run the risk of having urinary or fecal incontinence and disc issues in our back. So what do we do about that? Everyone has probably heard of Kegels. Those are basically just contractions of your pelvic floor muscles. So one of the things I would like to do right now is teach everyone how to do a Kegel. So what I want you to do is sit on whatever surface you're sitting on right now. And I want you to preferably have it be a chair or like something with a firmer surface and not on the floor, because I need your feet to be hanging off the edge. So you're going to sit, and I'm going to tilt this a little bit so that you can see. So you can see that I'm going to lean forward with my elbows on my knees. And then I'm going to try and squeeze my pelvic floor muscles like I am trying to hold in gas. So you're going to squeeze, and then you're going to feel those muscles lift away from the surface that you're sitting on. They're not actually going to go anywhere because those muscles don't, but you just want to feel that like sensation of lifting up and away. And then when you let go, you want to sense that going back down towards whatever surface you're sitting on. That's your pelvic floor muscle contraction or your Kegel. The way you know that you're doing it correctly is that you don't see any other body movement. So if I squeeze, but you see me, or if I squeeze and I'm like making a lot of faces, I'm using accessory muscles, and it just means that you're not isolating your pelvic floor muscles. And it's not a very efficient contraction for training your pelvic floor. It doesn't mean that every time you use your pelvic floor muscles that you need to isolate them. It just means that when you are training, that's what you need to do. So I do have to give a little caveat here, is that if you have pelvic pain in your genitals, pain with pelvic exams, tampon use if you use those, intercourse, tailbone pain, these things would be like a red flag that you may not be a good candidate to do pelvic floor training at this moment in time. So if you have any of those things, please go see your doctor, because none of those things should be painful. And if they are painful, then it is not normal. And another caveat, a lot of doctors out there still, and this includes gynecologists, are not fully aware on how your pelvic floor muscles can cause pain. So if you go to a doctor and they say, oh no, I did an exam, there's nothing wrong, there's no disease, I don't see like anything anatomically wrong, like you're good to go, but you still have pain, then go see another doctor. And it doesn't mean they're a bad doctor, it just means they just don't know about this one thing. So if you're okay with doing pelvic floor contractions and you don't have any issues, then you can start. I would say that most people who have about average pelvic floor strength, meaning that they are not leaking anything, and that you maybe exercise occasionally, I would say that that's probably average, then I would start at holding 5 seconds. So you're going to do what we just practiced. You sit on your firm surface, you're going to squeeze, and you're going to count 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, and then relax. And the way that you maintain strength that you currently have is by doing 2 to 3 sets of 10 of those 5-second holds a day. And then the way to increase strength is then you have to do more sets of 10. But I do not recommend doing them all at once. I recommend breaking them up throughout the day, because if you have not been training your pelvic floor, then by the end of your set of 10, then you're tired already and your muscles will not contract as efficiently. It doesn't mean you can't do it, it just means that it's not as helpful for strength training. So I just want to check and make sure that I'm saying all the things that I wanted to talk about. So when we talk about our pelvic floor muscles and how they affect our dancing or exercising, they are involved in everything that we do. If your transverse abdominis, that's your deepest layer of your abdominal muscles, is working, your pelvic floor muscles are also working. They contract together and you cannot separate them. So when you are doing a jump and landing, there is a pelvic floor muscle contraction, or there should be if it is working for you. And then when you are done with that motion, then it goes back down to its resting tone. That should happen automatically. And I don't necessarily want you to go into your dance class thinking about, okay, everything I'm going to do, I'm going to squeeze my pelvic floor muscles, and that's going to help me with my balance and core stability and all of that. I would say that there is too much of a good thing. So let your body do what it's going to do. And then if you have a problem like leaking or organ prolapse where your pelvic floor muscles are too weak, see a pelvic floor physical therapist or your doctor and find out exactly what you need to do. Because there's no like one size fits all. Like everyone is very individual and they all need to, be treated like an individual. So like I said, if you're doing your jumps, if you're lifting, if you're pushing, pulling, anything, your pelvic floor muscles, because you're engaging your core, they will automatically engage. And then if you are wanting to make sure that you have a balanced core, then you are doing some, core strengthening, that you want to do. So that could be your abdominal and your back exercises. And then you're going to add in your pelvic floor contractions. So that is the majority of what I wanted to talk about. I do want to just go over a little bit of what is normal for what you should be feeling with your pelvic floor muscles and what is abnormal. Just so that you know, gosh, if I have these things going on, like, do I really need to do something about it, or should I be concerned? So basically, normal is to not have any pain in your genitals or your pelvic floor region, and no leaking whatsoever. Sometimes people will say, oh, but if I'm pregnant or if I've had kids, or if I run really hard, like, I've been told that that's actually normal. And my response would be that it is not normal, it's common. So it means that there is some imbalance, whether it is with your muscles or if there's some ligamentous structures in your pelvis that are not functioning as well as they could be, then that's what's the issue. The issue is not I'm pregnant and that's going to happen no matter what, or I'm a long distance runner and that's going to happen because I'm running really hard. If you exercise and you leak, the problem is not the problem is that your pelvic floor needs to be strengthened in almost all cases. So there's that. And then the things that are not normal, obviously we've already said leaking is not normal, pain is not normal, feeling like something is falling out the bottom is not normal, tingling, numbness in your genital region. And just to talk very briefly about your menstrual cycle, killer cramps are not normal. The ones that are totally incapacitating. So if you have any of these things, please, please, please go talk to your doctor. And if you're having trouble finding a doctor and you know me, please contact me. And if you don't know me, then you can find my email address on the nueBOX website. And I will be happy to help you find whatever you need. I am not sure how we are on time. I've been talking for about 20 minutes right now. I'd like to open it up for questions just to see, did you get the answers that you were looking for, and what else would you like to hear? Oh, and Julie just put in my email address in the little chat. Okay, any questions? Are there other exercises other than Kegels? That's a good question. I would like to go back to talking about core strengthening, because I think that at least through exercise science and just generally the gym world and people who do not talk about dancers specifically, we hear, like I said, about all of the crunches, like the sit-ups, even the back exercises. I actually don't think that those in general help us as dancers. I think that core exercises that require you to be moving dynamically. So I would say working on your balance, like if you have a balance board or a Bosu ball, or even just standing on one foot and moving the rest of your limbs, that requires so much core stability, and that if it's difficult for you, working on those sorts of things is actually really good for your core strength and stability, and it will work your pelvic floor at the same time as your abdominals and back muscles, because your transverse abdominis and your pelvic floor muscles always work together. Another good exercise is doing either like a push-up or plank position on the wall or on the floor, like depending on what your ability is. So on the wall would be easier. And you would put your hands up, and then you can either have like a resistance band around both your hands and then moving different directions. This also is really good for your rotator cuff. If you have shoulder injuries, careful. And then moving. Or you can do it without a resistance band and touch, different areas and reaching, and then also picking your legs up and doing the same sort of thing. So like I said, you can do that against the wall or on the floor in your plank position. Okay, so there's some more questions. What does a physical therapy session for the pelvic floor usually entail? So when you first come to your first appointment with me, you would we'll basically talk for the first at least 20 minutes because I need to know all of your history, and I need to know like what are the issues you're having and what are you experiencing. So the first part is mostly talking. Then I would screen your low back and your hips to make sure that there's nothing that needs to be addressed there. And then we would move on, as long as you're okay with it, to doing a pelvic exam. So the very first thing that I look at for a pelvic exam, let's get my model, is that I'll have you undressed from the waist down. You can use the restroom beforehand, and if you have your cycle, then you still could have the pelvic exam. We use gloves. There's like a little chuck underneath it. We just throw in the trash. It's no big deal. If you have, a uterus and you're fertile, then you bleed and it's normal. So basically the first thing I'm going to look at is just coordination. So I would have you try and do your Kegel contraction, squeeze your pelvic floor muscles. I would have you try and bear down. So push like you're going to pass gas or have a bowel movement. And then I would have you cough. And I'm looking for coordination and movement of those pelvic floor muscles. Then I'm going to touch on the outside. So see, and just checking, do you have any pain externally with that pressure? Then I would do on the inside. So I'm just going to use my hand here. So I would be putting pressure, and I'm assessing, what do your pelvic floor muscles feel like? Does your tone feel normal? And then also you would be reporting back to me, do you have any discomfort, pain, tingling, numbness, anything weird happening? Then I'll have you squeeze around my finger. That's testing your strength, and that's called a manual muscle test. I basically grade you on, you get a grade, on a scale of 0 to 5, 5 being a super good, strong pelvic floor muscle contraction, which PS, almost no one comes in with a 5. I do not have a 5. 0 meaning nothing's happening down there. Your pelvic floor muscles are not contracting at all. And the only people who come in with that are those who have a neurological issue or a spinal cord injury. So I would test your strength, and then I would have you squeeze and hold, and I would test your endurance by just, counting seconds, how long can you hold for. Then I would have you bear down one more time for me, and I would be checking for pelvic organ prolapse. There are some other little things that I would check, and they change based on what you come in and, report to me what is happening to you, but that's the basic pelvic exam. Once that's all done, then I'm telling you I'm looking for and why I'm doing the things I'm doing the whole time, so you know exactly what's going on. And then afterwards, I would give you handouts and just talk about, okay, these are our first steps. This is what the rest of therapy is going to be like. And as far as follow-up sessions, it would just be very individual to whatever is happening to you. Okay, next question. How does a weak or strong pelvic floor show up in dancing? So someone who has pelvic floor muscle weakness with dancing, you could have poor balance. That would be, one way, but there are many reasons why you might have poor balance. So I don't know for certain that is the cause, that your pelvic floor muscles are the cause of poor balance while dancing. But I would say the number one thing would be if you have any leakage while you're jumping, lifting, doing things that require a lot of physical effort. If you're having leaking during that time, then I would say you most likely have pelvic floor muscle weakness. The way to know if you have a good pelvic floor is that everything is working just fine and you don't have any issues. Next question. As a PT, do you give external exercises to work on pelvic floor? Do you know anyone who does internal manipulation work in Phoenix area? That's a really good question too. I do personally give some additional exercises that are not just pelvic floor related. And a lot of times they are some component of a dynamic core exercise. And I have my patients specifically think about their pelvic floor while they're doing them because they have a weakness if that's the case for them. And then I know quite a few people who do internal manual therapy for pelvic floor muscles. I'm one of them. And I work with Banner Physical Therapy. We have clinics all over the valley, and I want to say we have something like 12 pelvic floor physical therapy specialists who do internal work also. I know that there are others in the valley, and but I don't know all their names because there's actually quite a few. We're very lucky here in Phoenix, even though we're still kind of hard to get into because there aren't enough of us. We have a lot. And just so if you wanted to find me personally, then I work at the Banner Clinic on 16th Street in Camelback. So our address is 1661 East Camelback, Suite 152. Okay, next question. Is it possible for your pelvic floor to be too tight? Yes, yes. I would say that 60% of my patients I actually treat for like some version of a pelvic pain disorder. And those would be the people who have almost always pelvic floor muscles that have too much tension in them. So you have your pelvic floor muscles, let's say that this is normal tension, that when you are bearing down to go to the bathroom, that you can relax fully. And then when you contract your muscles because you don't want to go to the bathroom, that you're able to contract fully. So this would be your normal resting tone. But the people who have too much resting tone, they're stuck like this all the time. And then when they go to contract, well, they don't have any strength because there's nowhere left to go. And then when they go to bear down, they can't bear down very well either because they're stuck here. I would say that if you were to feel your own pelvic floor muscles, yes, that's very exciting. So you would have to if you have a vagina, you'd have to put your finger on the inside. If you do not have a vagina, then you can check rectally, or you could just try and put a lot of pressure at the base of your scrotum, between your anus and your testicles. So anyway, what you want to feel for is your normal resting tone should be like my bicep when it's not working. It's squishy, it's like a marshmallow. It's jiggly, like that's normal. All of our muscles, when they're at rest and not working, they should be kind of like this. And then a muscle that feels like it has too much tension in it, it's like my bicep when it's hard all the time and it never gets to fully relax, so it's overworking. So then your pelvic floor, someone who has a normal resting tone, I should be able to put pressure and squish it. And someone who does not, it feels like a wall, it feels like that. Okay, so next question. The Kegel attempt felt like I was elevating my anus, is that right? And the answer is yes, because your pelvic floor muscles govern all of your holes. So there's your anus, there's your vaginal opening if you have one, there's your urethra. So you should feel like your anus or your rectum pulling up away. Now, some people have really good awareness and can feel, oh, I feel like I'm engaging the muscles around my urethra more versus my rectum, and you can guide your body one way or the other. But most people who come in to see me don't have that kind of awareness and control. But so basically the answer is yes. Is there a way to loosen your pelvic floor? Yes, I help people with this. That is that 60% of the patient population I see with pelvic floor muscle pain. And basically, like I said before, these are muscles like anywhere else in the body. So you need to basically stretch them. But because they're not on the outside and they don't cross joints, like if I talk about stretching my forearm muscles, then I would straighten my elbow and pull my hand back, and that stretches. But because it doesn't cross any joints, there's, none of these bones move. Well, your coccyx does a little bit, but it's not enough to do anything. And this does move just a little bit, but it's just millimeters. It's not enough to give it a stretch. So there are ways to put some pressure externally. So we can try this right now. You can, on your firm surface, you're gonna take your fingers and you're gonna curl them up like this, and you're gonna feel where your sits bone is. So that's that, on either side, that's that bone that you sit on. So on here, it's these bones. And then while you're sitting, you're going to find the inside aspect of it. So between the bone and your vaginal opening, if you have one, or the base of your penis, if you have that. And then you're gonna curl your fingers up and you're gonna sit on it. So, that. I'm not gonna show you my sits bones, but. So I'm gonna feel there, and I'm just curling my fingers up, and I'm literally just sitting on my hand. So if you have pelvic floor pain, that may or may not be effective for you. I have people where that is effective, and I have people where it's not. It depends on how far you can put pressure up and what muscles specifically are affected and to the degree. So that is one way. And then the other way is internally. So if you have a vagina, then you would use your finger, or there are special stretching tools that we use in physical therapy called dilators. There's also pelvic wands, and those can be used to do stretches internally. You also can stretch your pelvic floor muscles through your rectum. So for people with penises, then it would most likely, if you needed internal stretching, would be through your rectum. Okay. Next question. What is the relationship of the pelvic floor with the movement of the pelvis while dancing or moving in a plie or in a lunge? Okay, so my answer for this is going to be a little bit general, because the answer is it's kind of the same based on whatever movement you're doing. If you're going to do a plie, then here's my pelvic floor here. So with my hopefully normal resting tone, and here are my transverse abdominis muscles. So they go across like this. So I'm gonna do a plie, and hopefully, if you have good core control, then your transverse abdominis, it engages a little bit, and then your pelvic floor muscles will also engage a little bit. And the same thing, in fact, it will engage more so when you're doing a lunge. Because if you're doing a lunge, you can see how my leg is moving away from my body. Then whenever a limb is moving away from your torso, your pelvic floor and your transverse abdominis are going to engage more. And that's just a general, same reason as like if I'm holding a weight and I move away from my body, it's harder than if I held that weight close to my body. And so you don't need to stabilize your core as much because it's more proximal. Okay. So I think that might be all the questions. Are there any more? Okay. Well, I hope I didn't talk too fast. And I hope that everyone got all of the information that they were looking for. Like I said, if you do have other more specific questions, I actually talk about this stuff all day, you know, when I'm at work, and I like it. So you can email me, and that would be, you know, perfectly fine. I would be happy to talk to you. So everyone, have a really good night, and thank you for joining me during this crazy pandemic we're having. Thank you. Bye.